Hello everyone! I'm excited to walk you through the step-by-step process of using Bactigras for wound dressing. This is especially useful for all you healthcare professionals looking to enhance your wound care techniques. Let's dive right in. Step 1. Prepare the wound area. It's crucial that the wound is clean before applying any dressing. Gently cleanse the wound with saline or an appropriate wound cleanser. Make sure to pat the area dry with a sterile cloth or pad. Step 2 involves preparing the Bactigras dressing itself. Bactigras is impregnated with an antiseptic solution which helps prevent infection, but handling it correctly is key to maintaining its sterility. Open the Bactigras packaging using aseptic techniques. This might mean using sterile gloves and tools. Now, for step 3, applying the dressing. Cut the Bactigras to fit the size of the wound if necessary, but remember, avoid touching the side of the dressing that will contact the wound. Gently place it onto the wound, ensuring it covers all areas adequately. Step 4. Secure the Bactigras. You can use a secondary dressing or bandage to hold the Bactigras in place. Make sure whatever secondary dressing you choose does not stick to the wound itself, as this can disrupt healing when removed. Finally, step 5. Monitor and change the dressing as needed. Keep an eye on the wound for signs of infection or any adverse reactions. Change the Bactigras according to the wound's exudate levels and as per the guidelines provided by your healthcare setting. That's it. You've successfully applied Bactigras to a wound. This dressing is a fantastic choice for managing minor burns, cuts, and abrasions, and helps greatly in reducing the risk of infection. Remember, each patient and wound is unique, so always tailor your approach to individual needs. Thanks for joining me today. I hope this guide helps you feel more confident in your wound care practices. Stay safe and keep up the great work.